Are you a good candidate for gynecomastia surgery? Gynecomastia can range from just a little bit of extra fat to an extra amount of glandular tissue to a lot of extra skin. Some patients have actually lost a lot of weight from gastric bypass surgery or lap banding surgery and have a lot of extra skin and have extra glandular tissue underneath. The type of procedure that's done for all of these different problems is very different. For people who have a small to a modest amount of extra breast tissue, I usually make a small incision right at the edge of the areola. I can take out that extra breast tissue, and then I use liposuction to feather the edges so the overall shape is what that person is looking for. And most men want an appearance that looks like they've got some development of muscle without having that extra bulge in the center. That's a shape that I can achieve by removing that tissue and shaping the remaining area with liposuction. As the amount of tissue increases, the length of that incision may have to be a little bit longer, and so there's a small extension that can be made on either side of that areolar incision in order to remove a larger amount of breast tissue if necessary. For those men who have a lot of extra skin, removing the tissue underneath the skin by itself is not going to make the area look a whole lot better because that extra skin is still there. The area that encompasses the nipple is also going to be a lot lower than it should because of that extra skin. And so operations to correct the problem in that case involve removing that extra glandular breast tissue, shaping the fat in that area, and also removing that extra skin. To remove the skin, the incision is extended enough to remove it wherever that extra happens to be sitting. So that incision can be different for different problems. My preference is to avoid making incisions where they're not absolutely necessary, because if you're going to have the operation, you want to be able to expose the area, and having scars all over the place is really not ideal. So usually that operation will require an incision that sits along that fold underneath the breast. Sometimes there's a small vertical extension, but I limit the incision to what's absolutely necessary in order to get rid of the extra skin and produce a nice shape. But everybody who has extra skin there, as long as their general health is good, they're not smokers, and the amount of breast tissue is manageable, and they don't have an underlying problem that is causing the gynecomastia, are excellent candidates for surgery. I like to have the opportunity to talk to men and tell them whether or not there's something that they may need to address beforehand, whether that's a general medical exam, medications that they're taking that may be causing it, or drug use. And then once those issues are addressed, if there is something that needs to be taken care of, that's done first. If none of those are a problem and it's just the skin and breast tissue, then I can recommend the ideal operation to make the shape exactly what that person is looking for so they can be comfortable wearing whatever clothes they want or going to the beach without a shirt on. This is Dr. Kutty. Please give us a call at Luxe Plastic Surgery. Our number is 281-313-0551.